Yes, thank you so much, Stephen, for the McMaster Health Forum to give me the opportunity to present on the experience and lessons learned of the Evidence-Informed Policy Network, EVIPNet, in the WHO European region. It's really a great honor that I have been invited as your speaker today to the online platform and the top 10 webinars. I realized that to synthesize and reduce the multiple facets and dimensions of EVIPNet Europe into those 10 key points or messages is in fact quite a challenge. And I don't think really I'm doing justice to the richness of EVIPNet, its multitude of country players and the international, regional, in-house and external partners that are involved, and in particular the national champions that are working with us at country level. But I hope that I'm able to showcase and point to some of the interesting elements, some learning and some of the key insights when it comes to, on the one hand, to the establishment and the operationalization of a regional network, such as EVIPNet Europe, which is facilitated, coordinated and supported by WHO, as well as, on the other hand, what it means for countries to promote and foster evidence-informed policymaking at national level. So in that sense, I'm very pleased that you also announced that we have a second or rather third part of the virtual session, meaning the Q&A, where we can then address additional elements and or deepen some of the points that are raised. So if we turn to the first slide, first and foremost, an important insight for all those who wish to foster evidence-informed policymaking in the WHO European region is the realization that we are dealing with an enormously heterogeneous region. It's the largest and most geopolitically diverse WHO region with 53 member states, ranging from Iceland, Ireland, Portugal and Spain in the west to Kazakhstan and Kyrgyzstan in the east, from high-income countries to middle and low-income countries. And it encompasses countries with various health systems characterized by different, partially overlapping and mixed models, covering aspects of the Bismarck model with its health insurance system, the Beveridge model with the government as a single player, but then also the remnants of the Semashko centralized healthcare system model in former Soviet Union countries. Also, countries throughout the region have very different political systems, including presidential systems, monarchies, federations, and microstates. Monaco has 40,000 inhabitants, while the Russian Federation has 145 million inhabitants, just to show a bit the wide range. But also when it comes to the accountability and oversight, the policy authority, the functions depend on the characteristics of the policy context and the extent of centralization or decentralization, where we know that has an impact on evidence-informed policy making. And finally, when we have a look at cultures, religion, languages, the region really offers a great range. All this to say that while nowhere this is the case, that a blueprint approach in view of strengthening evidence-informed policy making in the WHO European region is definitely not possible. It will not fly and will not be successful in our context. The WHO European region is equally very heterogeneous when it comes to data and health research landscapes. In general, one can claim that the region here is one of the most advanced with regard to both generating high quality research evidence and facilitating its use. With regard to research to policy processes, the region is often cited with best practice models. For instance, we have the European Observatory on Health Systems and Policies, we have the Belgian Healthcare Knowledge Centre, or the Norwegian Knowledge Centre for Health Services. But nonetheless, we can say, and we can now move on to the next slide, that in our region, we can observe that health policy is often not optimally informed by the available evidence. You can see the findings on this slide here with regard to a study on knowledge brokering activities that took place in our region with a focus on EU member countries and EFTA countries, so European Free Trade Association countries. The study was published in 2013. And we can see that this comprehensive study identified a general lack of support for knowledge brokering mechanisms. So firstly, health systems, information and evidence is not consistently and systematically used. If used, then often only partially to justify decisions taken or in a narrow instrumental way. Secondly, many of the knowledge translation mechanisms of which we know that they work are not applied in these countries. Thirdly, it is insufficient support and incentives that exist for the use of health systems information. And then last but not least, no policies exist to enhance the knowledge translation efforts and the support that knowledge brokering could provide. When it comes to the rest of the region, no detailed study has been taking place so far, but that is a gap that we ought to and will in fact address later this year in conducting first the member states-wide survey, complemented then by qualitative assessments. What we did do, though, when launching EVIPNet in 2013 at the first multi-country meeting, we requested all participating countries to do a rapid review of their evidence-informed policy situation, undertaking a SWOT analysis, which was summarized then in a 4-suite analysis for the region. And the countries at the time, they did highlight that evidence-informed policy making often did happen, but in an ad hoc manner, that established reporting structures within the public institutions were missing, that there was a low level of understanding of the need, but also of the capacity when it comes to evidence use at the wider level, and that there was weak coordination mechanisms and human resources trained in evidence-informed policy making. So that just a nutshell, highlighting that if we combine the bridge study that I show on the current slide, and also the results of the rapid review of evidence-informed policy making, that our region clearly needs to also focus on strengthening evidence-informed policy making. Although when we have a look at and compare our region with others, we do need to realize that overall international attention with regard to evidence-informed policy making is low, and that we are in that sense a bit of a white or marginalized spot. So if we go to the next slide, because of the gap that was identified, we then finally, at the end of 2012, then had the launch of EVIPNet Europe, 7 years after the initiative was taken forward elsewhere in the world. And EVIPNet has the following mandate, as is shown on the slide. It first and foremost promotes the systematic use of research evidence in policymaking to improve health systems throughout a network structure. So in most countries, as I've said already, there is some form of evidence-informed policymaking that is taking place, but as shown, it's not systematic and not in a transparent manner, but rather happens ad hoc. The mandate of EVIPNet is also to increase country capacity in knowledge translation. So EVIPNet is all about putting countries into the driving seat, ensuring that they have the knowledge and skills to undertake evidence-informed policy making. And this requires training workshops at regional and country level, peer support and mentoring across the network, what the Secretariat is supporting and fostering. But we also know that individual capacity building is not enough. This competency needs to be institutionalized and respective structures developed, and therefore the network also aims to institutionalize knowledge translation through the establishment of what we call knowledge translation platforms. So basically intersectoral, interdisciplinary teams which plan, implement and evaluate evidence-informed policymaking activities, kind of an intermediary and advisory body providing the best available evidence to policymakers on a particular high priority health issue. So in summary, for this lesson learned, evidence-informed capacity building and EVIPNet Europe are much needed in the WHO European region. The network, though, and its activity must reflect and respect the heterogeneity and the diversity of the region's political, socioeconomic and cultural context, and foster country-wide ownership to ensure continued successful evidence-informed policy implementation. Going to the next slide. So the need for EVIPNet was recognized, as I mentioned already, a while back in 2005. EVIPNet was globally launched in 2005 as a response to WHO member states requesting the organization to put in place an innovative mechanism to bridge the research to policy gap. Next slide. And even going to the next slide, please. So being a laggard gave us in the region great advantage in many ways, because what we were able to do, and what I highly suggest to all others who are in the process of developing new initiatives, is to scan the horizon and map existing programs and initiatives that have been operating successfully to build on their experience. Because being a laggard allowed us to learn from EVIPNet Global and the previous activities that took place in other parts of the world. We were able to capitalize on lessons learned and past experiences, such as ensuring that a coordinator at the regional office here The regional office would be in place to guide and coordinate the network activities and develop a network strategy. But we also were able to tap into the portfolio of tools and approaches that EVIPNet with its partners developed, tested, piloted and validated in various countries. We benefited of EVIPNet's image and reputation. EVIPNet was and is standing for a social network, a movement to bring and partner up policymakers, researchers and other stakeholders, including representatives of the civil society. And then last but not least, we were able to take advantage of existing partnerships, such as with the McMaster Health Forum, who has supported EVIPNet since its inception and has been for many years now a highly appreciated WHO collaborating center. So capitalizing on what others have done is the second lesson learned, because that really allows you to tap into resources and experience, which then we adapt, as I highlighted in my first lesson learned, to our context, to the needs and the heterogeneity of our region. And this allowed us to move forward in a rapid manner. And in fact, we are by now considered as the most dynamic knowledge translation network of the WHO. So we understand that there's a need for EVIPNet in the region, and that EVIPNet Europe did not have to start from scratch, really was of benefit for us. But how did we really start off? What were the first steps, and how did we develop the knowledge translation network? And this is then my third lesson learned, is about ensuring that when you establish a network, to look for a suitable form. And this is something that we looked into in 2013, so really shortly after the launch of the network. An underlining premise of the knowledge translation network is that the whole is greater than the sum of parts, so that a significant additional benefit of participating in a network such as EVIPNet is that each of the parts become stronger. And so there are two complementary models that are key, or that are representing the two extremes. On the one hand, there's a highly centralized network. At its center is the Secretariat, with reciprocal relationships which occur with the Secretariat and the nodes, but not really any relationships between the nodes. Then in the centralized network on the right-hand side, all organizations or network nodes are linked to each other without a central coordination and facilitating body. So these are the two standardized models. But if we then turn to the next slide, EVIPNet Europe can be considered a bit of a hybrid, and in between of these two models. The network is currently set up in a fairly centralized network still, with predominantly reciprocal relationships with the Secretariat and to a lesser degree with the nodes among each other. And especially in the early stage of a network, while the network is still in the development and infancy stage, the strong and coordinating, facilitating and convening role of the WHO Secretariat has proven to be, in our view, highly valuable to advance the network. The network is constituted through voluntary association of countries to advance evidence-informed policy making. We have in our region a bit of a peculiarity that while voluntarily we do request accountability for action once countries have joined, because we have a bilateral corporate agreement with between the WHO and the various member states once they have joined, so where WHO negotiates and agrees every 2 years on new work plans with member states, including budgetary allocation. So it's in that sense voluntary at the beginning, but then when the work plans are being implemented, it becomes more binding. So at the same time, while the network is still fairly centralized, we do increasingly also foster peer support and mentoring between the nodes, as you can see in the figure on the left-hand side of the slide. We have countries that are more advanced in the networks, which have been part of EVIPNet since 2013, and while other countries have only recently joined last year. And the more advanced countries, they're encouraged to take on tutoring functions, to share experiences and give practical advice to the more junior countries, because quite often countries, they struggle with similar issues. And the National Evidence-Informed Policy Champion of more advanced countries have also been trained as trainers to more effectively be able to support their peers. So in the longer run, what we would like to see is, in fact, that the network becomes fully decentralized and self-sustained, that the support and coordination function of WHO is no longer needed, and that countries can mutually support each other without tools, resources, or external assistance. In the text box on the right-hand side, I've listed a few bullet points of what the key activities of various networks actors are, meaning the Secretariat and the countries. At the moment, the WHO Secretariat in Copenhagen and the regional office brings the members together. So, for example, at annual network multi-country meeting, we empower knowledge translation platforms of the countries in promoting evidence use through capacity building, regional country, virtual trainings, and the provision of tested tools. And also we identify and share best practices among network members and the wider knowledge translation community, including identification and development of new approaches to knowledge interaction. The network, as I mentioned, then what we encourage the countries to do is to foster peer support, exchange of experience, and also sharing similar problems and lessons learned. So this is the current form of the network. But another point, and then we go to the next slide, please, that I do also want to highlight, which is quite special for EVIPNet, but I think a very beneficial consideration when it comes to the form and the structure of the network, is that beyond what I've just explained, there are additional horizontal and vertical collaboration and exchanges going on between WHO, the WHO Secretariat, and the European region member countries. We do also have a vertical interaction with the network as a whole. So we're spread at 3 different levels, as you can see on the slide: the global, the regional, and the country level. And at the global level, a global steering group is ensuring coordination and governance with the regions. Furthermore, then also the WHO secretariats and the 6 WHO regions are interconnected horizontally, and we're exchanging experiences and processes. And also the country teams interact interregionally, so not only within the WHO region, but interregionally. For example, we have fostered exchanges with the Americas. We have been much collaborating with Chile. Same goes with the African region, in which quite a few countries have, in fact, developed very skilled staff in view of applying EVIPNet methodology, and we have asked them to support us and train our countries in knowledge translation approaches and activities. So in summary, with regard to this lesson learned, identifying a suitable form for a network is not a trivial task. It has to be well thought through and planned to ensure good network functioning. And once the form is in place, it can then be filled with content. And this brings me to the next lesson learned. So please, next slide. As a knowledge translation network, EVIPNet has in fact, a very diverse portfolio of functions. It is, on the one hand, an amplifier, a convener, a provider of services, in particular training, a provider of or a builder of communities, and a facilitator, coordinator, and also communicator. And all these various functions have been formalized in a strategy for EVIPNet Europe with a concrete vision and mission that was developed in 2013, so just at the beginning, and that is now up for renewal. EVIPNet has, as you can see on the slide, been operating according to 4 strategic directions. The first one, EVIPNet Europe, is meant to support knowledge translation networks in the sense that it's assisting countries in establishing of country teams, or these knowledge translation platforms, which are national networks dedicated to strengthening health partnerships among researchers, policymakers, and the civil society in their respective countries in order to enhance evidence-informed policymaking. Then the second strategic direction is about the network ensuring capacity building for its member countries, recognizing that limited capacity for knowledge translation is available in the region. EVIPNet Europe is providing technical assistance, as I mentioned earlier, mentorship and exchanges, plus routine capacity building workshops to improve the skill base of its network members. Then thirdly, the network is providing methodologies, tools, and innovations that member countries can use with the newly learned skills. And then lastly, it's also important for us to look a little bit broader At the national and regional level, EVIPNet Europe also promotes awareness and creates a commitment to improve the culture and practice of knowledge translation and evidence-informed policy making. So we recognize that country teams will be most successful and sustainable in regional and national environments that value the contribution of knowledge translation in health systems, research and policy. These broad outlines of directions has supported and given a sense of clarity and focus to countries, donors and also other partners to understand where EVIPNet is heading in the short, medium and also the longer term future, increasing external and internal buy-in and also commitment. So having a strategy provided increased operational efficiency and also coordination, and provided in many ways also a space for learning. Therefore, although it might appear a matter of course that initiatives and networks have and are guided by a strategy and formal terms of references, this is, as we have seen in other parts of the world with regional knowledge translation networks, not that frequently the case. And that's why my lesson number 3 is that once you have an initiative, or once you have initiated a network and developed its structure, management and governance, it's also important to think about a concrete vision, mission and strategic direction that will guide your work and coordinate the activities of various actors. So you will also, when it comes to those 4 strategic directions, hear but more about them in detail throughout the next lessons that are coming. But please, next slide now. So while we have built and benefited a lot from approaches and tools that EVIPNet has used throughout the world, we also made in our region an important difference. Contrary to other regions, we requested countries to perform a situation analysis as a very first step before commencing the evidence-informed policy-making activities in view of establishing then systematic processes of integrating evidence into policy. Such a situation analysis allows countries to understand the evidence-informed policy context, to see what are the driving factors, the barriers at national level to evidence-informed policy making, who are the key actors already involved, and what can the country build on. Such a situation analysis is also useful to develop a baseline study for national evidence-informed policy situation, building on the assessment, and a country can then develop a strategy, an EIP strategy. And also a key objective of the situation analysis is to identify the institutional niche for the establishment of a national EVIPNet Europe team, the knowledge translation platform. You can see on the slide a manual, a document that we developed in the office in order to support our countries through the process of undertaking this assessment, the situation analysis. Through the assessment, and I'm not going to speak very much about it, but just to highlight what we mean with institutional niche of a knowledge translation platform. Could I please ask for the next slide? So what the situation analysis helps countries to do is to see what would be the best hosting, the best way of placing and forming the knowledge translation platform. So the knowledge translation platform can either be a standalone and independent organization, so a forum or a think tank, as you can see on the left-hand side. The advantage of such a model is that it can leverage, the KTP can leverage its autonomy and into neutrality and credibility when it comes to policy debates. And it could also potentially be a strong neutral broker among health key systems actor. But then on the other hand, if we go to the middle, when a country team is hosted at another organization, here the advantages are that the KTP can capitalize on existing organizational strength, networks and employees, and there is no need to create a new operational system. The KTP is also part of an established network actor system, and if hosted within the Ministry of Health, there are close links to policymakers. So that could also be an advantage that countries would like to tap into when establishing their knowledge translation platform. And then lastly, when we look at the model to the right-hand side, there's also the possibility of establishing a knowledge translation platform in the form of a network. And this has the advantage of a light organizational structure, and that the network can employ best suited staff without regard for geographical boundaries. But then the key disadvantage is that the individuals leading or working for the network may only work on a time-limited basis, and in that sense, the sustainability is not given. So depending on the findings of the situation analysis and the local context, each country will decide where and how best to institutionalize their team. So it really is very context specific. Next slide, please. So the original idea was our initial thinking that once then the situation analysis was undertaken, information provided how the KTP should be established, and the KTP is in place, that we would then commence with trainings and capacity building so that the KTP would gain the skills to plan, implement, monitor, and evaluate knowledge translation activities. And this kind of knowledge translation activities you see in form of the EVIPNet action cycle. These are not the only activities that a KTP would undertake, but this just to highlight what potentially could be done, and I will also refer to that later on a bit. So I chose to focus on the knowledge translation or the EVIPNet action cycle in particular. So you can see in some ways that on this slide, our thinking was very similar to the regional level, that we first wanted to have the structure in place before we move over to the function, and I will get to that in a minute again. But when we move to the last slide, just to highlight what the results of a situation analysis could look like. Here, the example of the situation analysis of Hungary. You can see in the green highlighted box the suggested scenario of the knowledge translation platform, composed of a knowledge translation policy office doing the day-to-day operation of the knowledge translation platform, and which is currently, because it's piloted, located at the National Public Health Institute in Hungary. This is then supervised by a board of trustees and complemented by a network of scientific advisors from academic institutions, the Academy of Science, professional colleges, etc., that supports and assists the knowledge translation platform depending on the technical work at stake. And then the platform would be supported or would have external linkages to the Ministry of Human Capacities and the Secretary of State for Healthcare, the media, etc., and other external actors of relevance. In summary here, on the next slide, the benefits of the situation analysis. So apart from the idea of first form, then function, also the situation analysis provides additional advantages. First, it provides the possibility of increasing awareness for evidence-informed policy making. So the interaction with a diversity of stakeholders allows to increase awareness of the stakeholders for the need of evidence-informed policy making, the need for EVIPNet activities within the countries, and the need to strengthen the systematic use of evidence in policy. At the same time, the results of the analysis increase the understanding of the national evidence-informed policy context, what activities have been successful so far and on which the country need to build, what are the gaps. It also allows to build on evidence and to build an evidence-informed policy baseline and develop a national EIP strategy, as I was saying. The results of the situation analysis allow for the identification of the institutional niche on where and how to establish the national team, the knowledge translation platform. And then ultimately, it also leads to increased collaboration and strengthened interaction among stakeholders already throughout the process of the situation analysis. So those are key advantages. However, at country level, our experience has shown that form does not always precede function. In fact, while this distinction was fairly neat, as I explained, at the regional level, where the planning phase was followed by the activities and implementation at country level, this has often been running either in parallel or, and if we go to the next slide, as in the case of Estonia, the situation analysis has followed activities, concrete knowledge translation activities. So here again, saying that in Estonia, a different approach was taken. I'm emphasizing the need to be able to adapt and respect the different country needs and contexts. What happened in Estonia was that because of political consideration, it was decided to first start planning and implementing a concrete knowledge translation activity, so part of the knowledge action cycle I showed earlier. This is about developing an evidence-based policy, in this case on the reduction of consumption of sugar-sweetened beverages. This first evidence-based policy was meant in the country to serve as a proof of concept before scaling up and developing more sustainable structures and mechanisms. In 2017, it was that the evidence-based policy was published, and it was developed by a local team of researchers and policymakers. Perhaps before I continue, just a few general words on the evidence brief for policy. It is one of the key tools of the evidence-informed policy network. It's demand-driven and synthesizes the best available research evidence to answer specific high-priority policy problems in a concise way. It's written in a non-expert language and is adapted to the needs of various stakeholders. It's also based on a systematic search and appraisal of the global, regional, and also the local evidence to understand what is known about the particular policy issue and which policy options effectively address the issue. And then the evidence brief is in general an input to the next step, which was shown on the slide with the action cycle, is an input to a deliberative dialogue, a policy dialogue to effectively blend on the one hand, explicit and scientific evidence with tacit and evidence-based knowledge to guide policy development. And they have, so the evidence brief for policy and the policy dialogue have proven to be very effective tools. Getting back to the evidence brief for policy on Estonia on sugar-sweetened beverages, this one has turned out to have considerable policy influence. All 4 policy options included in the evidence brief were considered in policy processes. I don't want to go so much into detail here because I know that the EVIPNet Europe champion Tanja Kuchenmüller from Estonia gave more insights into this specific work in another top 10 webinar. So those are interested, I would rather like to encourage you to listen into this excellent seminar yourself. But so me providing this example just to say that based on the success of this first evidence brief, it was then decided now post policy brief publication, dissemination, development, to undertake a situation analysis, which is expected to be available next month, to institutionalize mechanisms for the regular development of evidence brief to policy, because it was found to be an important and promising way forward to systematically and transparently use the best available evidence in Estonian health policy making. So in that sense, although Estonia did not choose the path that we had suggested originally, it's nonetheless an excellent way forward of demonstrating why EVIPNet and why the tools and activities of EVIPNet are required in order to strengthen evidence-informed policy making at country level. Either way, and we can turn to the next slide now, whether first undertaking a situation analysis or commencing directly with a knowledge translation activity, the key mandate of EVIPNet is, as highlighted earlier, to provide capacity building opportunities to its member countries. And in that sense, the WHO Secretariat has developed various means and capacity building strategies, which can be summarized in a 3-tiered approach. On the first slide, you see here the preparatory track, which is one of the capacity building strategies that we are applying, and is meant in particular for new member countries. So in this phase, what we ask member countries to undertake is to identify ideally 1 or 2 champions that will lead the knowledge translation activities throughout the preparatory phase. These national champions also develop a short concept note assessing the need for and support to the country becoming the EVIPNet Europe member country. And they also implement first awareness raising activities to promote evidence-informed policy making in the country, in that sense preparing the ground for countries to become a full EVIPNet member. Next slide. The second EVIPNet Europe capacity building strategy or track is the multi-country track, where all by now 21 countries gather once a year for specific training purposes. This track primarily focuses on further strengthening the evidence-informed policy capacities of national champions and WHO heads of country offices, as well as providing ad hoc support, either by the Secretariat or peers, for other activities promoting the use of evidence-informed policymaking at national level. And next slide, please. Finally, EVIPNet Europe also provides country-specific training and capacity building. So 4 EVIPNet Europe members are part of this country-specific track. This track consists of 2 major set of activities, technically supported by the Secretariat. On the one hand, the establishment of a country knowledge translation platform through the development of the situation analysis, and then secondly, the planning and implementation of one full EVIPNet action cycle to start off with. However, what we realized is that capacity and skills building have shown to have a positive effect on evidence use and generation of this knowledge translation work only if capacity, capability, motivation, and opportunity are brought together. So if we go to the next slide, what we can see here is that on the one hand, to the left, we do need training, but this needs to be accompanied not only with the application of learned knowledge and skills, so the first arrow, but at the same time, we need to accompany this process by active technical assistance that guide partners through the process. So what we have learned is that we really need to provide hands-on support, coaching, technical assistance, and running this kind of a process in parallel to member states applying the knowledge and skills in view of knowledge translation planning and implementation, as otherwise, without this additional support, countries will not really provide the deliverables, the products, the knowledge translation activities at the rigor that EVIPNet would like to see its activities being implemented. So in that sense, this was quite a big learning element for us, that we cannot just provide a training and then be a bit more passive and ask member states if they are in need of additional support to come back to us, but rather instead of waiting for them to request our support throughout the entire process of application of knowledge translation, at least the first time of knowledge translation skills that were gained, to ensure that we support the process through coaching, through technical assistance, etc. One of the key examples where we have implemented the new learning, and please the next slide. We have proactively now promoted this new approach with 2 cohorts of member countries working on developing an evidence-based policy on antimicrobial resistance, on AMR, and conducting related policy dialogues. This slide shows the 2 cohorts, one which was launched in 2017, so this is the bigger one on the bottom, and the other one was launched last year. For the latter, we are closely collaborating with a master health firm together who supports the 4 countries, Bulgaria, the Republic of Moldova, Romania, and Serbia. And so far, the process and also the results are very promising. Next slide, please. My lesson number 8 is that much of the capacity building undertaken by EVIPNet Europe and other evidence-informed policy initiatives have in fact focused on research and policy makers, meaning at the individual level. Capacity at this level is in many ways the most fundamental element of capacity. It becomes the foundation for organizational and overall country capacity and refers to the ability of an individual to set objectives and to achieve them using their own skills. But what we also needed to realize increasingly, we knew it already from the beginning, but where we have to emphasize even more our attention and focus our attention to, is that the network now aims to sustain the capacity building, meaning that EVIPNet will need to look at the capacity also at the meso and the organizational level. So that here at the organizational level, we understand that this is very important in terms of determining how individual capacity is utilized and strengthened. And this level refers to anything that will influence an organization's performance and includes human resources and the physical resources, the interinstitutional linkages, the networks and partnerships, the incentives and reward systems, and also the organizational culture and leadership of managers that allows the application of the individually learned skills and knowledge. And then finally, capacity at the environment via environmental level also needs to be strengthened, which refers to the conditions necessary for demonstrating capacity and at the individual and the organization level. And this includes systems and frameworks necessary for the formation, implementation of policies and strategies beyond an individual organization. So in other words, for us to be successful as a knowledge translation network with a sustainable impact, we need to increasingly broaden our capacity building activities to effectively target all three levels of capacity building as shown on the slide. Linked to the macro and even the wider context, so meaning the evidence-informed policy environment at regional level, which affects the national level, WHO Europe has, as a global and regional authority in health, the possibility of catalyzing change. And please to the next slide. In the WHO European region, there are 5 key programs, initiatives and networks that foster evidence-informed policy context at regional level. First, the EVIPNet Europe, the evidence-informed policy making, WHO's leading mechanism to implement evidence-informed policy making at country level. Secondly, we have been speaking so much about it, I don't need to focus more on it, but moving on to the Health Evidence Network, HEN, is another program of the region which fosters evidence-informed policy making at a wider level with its synthesis report, which uses multidisciplinary and also intersectoral sources of evidence to support policy making. These demand and policy-driven HEN synthesis reports summarize what is known about a particular policy issue, gaps in the evidence and areas under debate at regional level, and hence complement the work of EVIPNet operating at country and increasing capacity. The Hungary Access to Research of Health program, which may be known to many of you as not specific to the WHO region, was set up by WHO together with major publishers and enables low and middle income countries to gain access to one of the world's largest collections of biomedical and health literature. So up to 15,000 journals are accessible. And I don't need to emphasize that this is a crucial aspect to foster evidence-informed policy making. Another program of importance I'd like to mention is the WHO European Health Research Network, which is a new network with 6 members currently, which focuses on strengthening national health research systems, of which one of the 4 core functions deals with fostering the use of evidence in policy and practice, which is covered by EVIPNet Europe. And then finally, the EACHR, which is the European Advisory Committee on Health Research. This is the highest advisory body in the region on research matters. It directly advises our regional director with the aim to promote and strengthen the use of research evidence for public health decision making and to inform policies for the development of health research in the region. Next slide, please. The WHO European Health Information Initiative, which is shown on this slide, is the overall umbrella initiative under which the before mentioned regional programs and networks are all operating. It is a multi-partner network coordinated by WHO in the regional office here. It supports the integration and sharing of existing knowledge, expertise and good practices in the area of health information, and is the vehicle for integrating and harmonizing health information within the European region. So this is the umbrella. This umbrella is creating an ecosystem bringing health information, health research, and also evidence-informed policy making together. Finally, next slide. At the macro and regional level, there's also an action plan and resolution I'd like to mention to strengthen the use of information, evidence, and research, which was developed and adopted by all member states in our region in September 2016. WHO Europe is so far the only region with such a resolution focusing on knowledge translation worldwide, and is therefore pioneering these efforts. And through this action plan and resolution, member states have committed themselves to step up their investments in producing, disseminating and using multidisciplinary health information and evidence and policy, And at the same time, our member states have requested us as WHO to strengthen our own efforts in supporting them in evidence-informed policy matters. In that sense, this resolution and action plan have given us great momentum to evidence-informed policy making, and also the work of EVIPNet impacting on the regional culture of evidence-informed policy making. So in a nutshell, WHO's position and function as global health authority can be used to promote a culture and policies of change at the highest levels through, for instance, proposing regional action plans and resolutions, in working with our member states and ministries of health via various regional programs, but also by convening ministries of health on a regular basis at meetings. For example, just last September at the regional committee, all 53 member states have deliberated at various events and sessions the importance of the European Health Information Initiative, including the Evidence-Informed Policy Network, increasing the awareness for health information and knowledge translation, and increasing and creating a sense of regional urgency for this subject matter. Next and final slide. Finally, so here, my key lessons learned is that fostering evidence-informed policy making is about capacity building and providing tested and effective methods for knowledge translation. It's about aiming to institutionalize evidence-informed policy capacity at country level, which requires resources, financial but also human, and it's about context, the organizational, institutional systems and environmental level, which needs to be looked at. So these are the symbols, the icons that you see on the right-hand side. But at the same time, and next slide, please. It's ultimately, and this is at the same time for me also a great personal enrichment and reward, it's all about the people. EVIPNet is a social network that thrives on the commitment of its members at country level, the partners who believe in it, and the evidence-informed policy, and see evidence-informed policy making as a necessity to move forward in view of improving health and contributing to the achievements of the Sustainable Development Goals, but also seeing WHO in our region, the senior management, and last but not least, our regional director are supporting this area, and this is really invaluable. The combination of people, the personal motivation, the incentives, the passion, the strong vision and direction, and the feeling of identity and belonging to a community, which we have been able to form, that is really the motor of evidence fostering of the evidence-informed policy making, and has made the evidence-informed policy making network in our region now to, as I said at some point, the most dynamic knowledge translation network of WHO, and we can trigger change and capacity at all three levels. This is the aim of EVIPNet, and we are making it reality. So with this last lesson, I would like to thank again the host, the McMaster Health Forum, for the opportunity to present today, and would like to hand over. Thank you very much.
Thanks very much, Tanja. That was a really insightful presentation, and thanks for sharing some of those lessons learned, not only from your experience in building up EVIPNet Europe, but also how that could be translated to other people looking to build sort of similar networks. We'll maybe just pass it over to you, Kalen, to share some of his insights quickly, and then see if we have a few minutes to answer a couple questions.
Thanks, Steve. Can you hear me okay?
Yep, we can hear you fine.
Great. So I want to keep this short and sweet because I know that we got a little bit of a late start, and I really want to give people the opportunity to ask some questions because I see some others are coming in. I just wanted to extend my sincere thanks to Tanja for giving us such a really great overview that I don't think many of us today on the webinar have a chance to see very often. It's a strategic lens on how a region in the world views evidence-informed policymaking, and most importantly, the practical ways. And I know that personally, Tanja, you're one of the most pragmatic people I've ever met. So it's really helpful for me to see something worked through so fully with such an emphasis on doing the right thing and trying to move the needle on so many different dimensions that can get an entire region off to the races with evidence-informed policymaking. So it's such a treat for me to sit back and listen to you. I think this is probably one of the first times I've had the chance to have you present to me, because usually it's the other way around. You're sitting in the back typing taking notes and making sure that I'm on task given what you've been asked me to do. So a real treat for me. So I again, just want to emphasize how nice it was to have you give that overview. A couple of quick things from me, just some reflections really on my engagement with the work that Tanja has been spearheading in Europe. And it's really not a 30,000-foot view as to what Tanja really presented, but more of a granular take on some of the takeaways I've had with engaging with some of the countries in the network that are trying to get up to speed with how to do this right. So I think the first lesson that I've learned is that there is a need for innovative models for supporting this when you're trying to mentor and build capacity. Tanja mentioned that a lot. So things like the cohort approach, which Tanja mentioned, is vital and an innovation that is new. Everyone is really kind of focusing on the same issue. So we've seen this in the past with EVIPNet Africa and their work on artemisinin and combination therapy for treating malaria. This is something that has been done before, but really not pushed to the same extent that Tanja and her team in EVIPNet Europe has done. A second thing is that there's a need for the full range of skills to be developed, and you've alluded to this, Tanja, but there's a need for policy analysis, so all the things that we need to do to understand how to use evidence to inform our problem framing, identifying options for addressing them, and implementation strategies. You mentioned the situation analysis, which is essential for that political type skill set that you need, so understanding the political context, systems analysis, synthesis skills, as well as stakeholder engagement. And finally, and this is the most important key lesson that I've learned, is that we need to find ways collectively to reduce the intimidation factor. So as I'm sure many of you are taking away from this presentation, there's a lot of moving parts here, and it can be intimidating for someone who's doing this off the side of the desk, specifically if it's new material. So these people are often working in difficult political climates on top of all of this. So I think that there's a need to now strategically focus on how we, at the more kind of mentorship level, make it seem like all of this stuff is completely doable. And so Tanja knows very well that I've really focused the last year or so of trying to figure out how to do this better. And I think we're making progress, but there's ways to improve there as well. So those are my big three takeaways from my experience with Tanja. Again, thank you very much for taking the time today. And I'm going to pass it over to others who'd like to ask questions for Tanja.
Great. Thanks, Kalen. I know we're running a bit over time, but if we can just take a couple of minutes here to answer a couple of questions. The first one asked, or said rather, health technology assessment is an area of practice to translate research evidence to inform policy and decision making, primarily for decisions about the reimbursement and coverage of drugs and medical devices. And then they would like to know what the relationship is between EVIPNet and other evidence to practice initiatives described in the presentation and health technology assessment, and whether this is considered as part of the scope of work covered in these initiatives, or is HTA seen as something separate?
Yes, thank you very much for that question. We would consider HTA as being a sister aspect of what EVIPNet is doing. So there are a lot of similarities, same also with guideline development committees, for example. And what we will be doing more in the future, even though than we are doing now, and at the moment we have not really started any work on that in our region, but I believe the Americas is doing it, is partnering up and creating synergetic effects between HTA and also the work of EVIPNet. But in our region so far, we have not closely collaborated.
Great, thanks, Tanja. And then another question was just that you'd mentioned, I guess, in your presentation that policies are usually not based on evidence. And so the first question was, what are they based on in Europe? And then more of a comment, I guess, that from their experience in other parts of the world, they're usually based on satisfying the demand of the voting public or the demands of certain groups. So within your capacity building on the micro, sorry, it said from what they understood, your capacity building on the micro level is minded with individuals. What would be the most suitable form of tools for citizens to support them to use research evidence when advocating for change?
Yeah. So when it comes to the development of policies in the WHO European region, it's just like in many other parts of the world that evidence is only one of the factors influencing the process. And this is why, in fact, what we term, we don't say evidence-based policymaking, as you've heard in my presentation. We always emphasize that it should be evidence-informed policymaking to stress that, again, evidence is one factor which we would like to see being strengthened and more increasingly, transparently and systematically being taken into consideration when it comes to decision making. But we know it's never going to be the only factor. There is no specific factor I can point out in the WHO European region that would be the most dominant, because it's always a potpourri of different factors that come into that equation. Very often it is the voters, the citizens who have specific opinions, beliefs that policymakers, of course, in democratic systems have to take also into consideration when they take their decisions. When it comes to citizens, what EVIPNet is increasingly also looking at, what McMaster and the Health Forum is doing, is looking at citizens panels and involving citizens in that sense. But that's a bit of a different answer that I'm giving here than what was asked in view of specific tools that citizens could use to make them more evidence informed. And here I wouldn't know if, because we're more working counterparts, other ministries of health, research institutions related to ministries of health, and rather at the institutional level, not going down to the citizens. But perhaps, Kanan, would you have specific tools that you could point out?
Thanks, Tanja. Sorry, Kalen had to run to jump on another call, so he has left. But I think your suggestion of the citizen panels is certainly one way that we're trying to, engage citizens in the policymaking process, not only to get them involved, but also to take their feedback and pass it on to the policymakers and others who are working to make these decisions, and include that, as you say, as kind of one of the inputs, that it's the evidence as well as the values and insights from citizens and other people involved in the process. So I think that's about all the time we have for today, but I just wanted to say thank you again, Tanja, for joining us. We really appreciate you taking the time to share your insights and lessons learned. It was a very interesting webinar, and I'd also like to thank all those who joined us today for the presentation. We do have a number of other top 10 webinars coming up each month. You can go to our website, the McMaster Health Forum, to see the webinars that are currently scheduled, and we'll be adding more of those as well. So we certainly hope that you'll join us for some of those future webinars. Thanks again, Tanja, and thanks everybody. We'll hopefully see you in our next webinar.